APPG questions. Coming from anatomy, one question was asked regarding testis. Remember, testis is mesodermal and it descends into scrotum at birth. The option was given as 6 to 8 weeks. That was the wrong option. Next, regarding sciatic. Remember that sciatic nerve does not supply gluteal region, usually supplied by superior gluteal nerve, inferior gluteal nerve, and nerve to obturator internus. And again another question was asked regarding radial nerve and ulnar nerve. The scenario was numbness of little finger and ring finger with hypothenar atrophy. Which nerve is involved? The answer is ulnar before division into superficial and deep branches. Root value of long thoracic nerve. Answer was C5, C6 and C7. Also nerve to serratus anterior. Next question was asked, sternocleidomastoid supplied by all except. Sternocleidomastoid supplied by all except. This was the arterial supply. The answer was thyrocervical trunk, as this supplies indirectly. Remember occipital artery, anterior auricular artery, superior thyroid artery, and suprascapular artery. These supply directly, but thyrocervical trunk supply indirectly. Next question was, all of the following develop in mesentery. All except develop in mesentery of stomach. The answer was kidney. Remember, liver, spleen, pancreas develop, but kidney does not develop in mesentery of stomach. Number of vertebrae usually are constant in. This was the next question. We know that there are many types of vertebrae like cervical, thoracic, lumbar, sacral, and coccygeal, but number of vertebrae are usually constant in which area? The answer was cervical vertebra. Cervical vertebra are usually constant. Variability is seen in coccygeal vertebra. Ciliary muscle develops from. This was another important question. This is a probable APPG question. Ciliary muscle develops from. The answer is neural crust mesenchyme. Neural crust mesenchyme. Also remember origin of iris, ciliary epithelium. These are neuroectodermal origin. That is the difference between ciliary muscle origin and ciliary epithelium origin. Epiglottis develops from. This was also asked. The answer was fourth pharyngeal arch. Again, this is another important question. probable APPG question. Ligament connecting meniscus to tibia. Names of ligaments are very important. What connects menisci to tibia? The answer is coronary ligament. Coming to biochem. Following is not a second messenger. The answer was guanyl cyclase. And next question was regarding blood supply. Increased blood supply to muscle seen all except. The options were local metabolites, sympathetic stimulation, parasympathetic stimulation, and inhibition of beta receptors. The answer is inhibition of beta receptors, as local metabolites can increase vasodilation. Sympathetic and parasympathetic, called as sympathetic cholinergic system, they can also increase vasodilation. This is another important question. End diastolic volume increases with. We know that when there is a deep inspiration, there is increased venous return. What causes deep inspiration is negative intrathoracic pressure. The answer was negative intrathoracic pressure. Next question, right axis deviation physiologically seen in. So nothing pathology. Where is it physiologically seen? It was seen in thin and tall patients was the answer. Other physiological causes are end of deep inspiration, standing posture. Self-stimulation is related with. The next question was self-stimulation is related with was asked. The answer was medial forebrain bundle. Medial forebrain bundle. Named procedure kinemyography is used for. The answer is monitoring neuromuscular function. One question was asked regarding dopamine cruise. The option was dobutamine decreases peripheral resistance. And coming to next subject, that is important questions in biochemistry. No loss of genetic material occurs in. So this is also a probable APPG question. No loss of genetic material. It is inversion. True about ribozyme. Next question was true about ribozyme. Remember, ribozyme has peptidyl transferase activity. The answer was peptidyl transferase activity. Next question is test to differentiate in chromosome of normal and cancer cells. The answer is comparative genomic hybridization. Comparative genomic hybridization. Next is another important question, probable APPG question. Enzymes found in CSF. Answer is creatine kinase and LDH. Frequently asked question. Next question was following was associated with membrane graft. This is a new question. The answer was GPI anchored protein. A clinical scenario was given: child with low blood glucose, unable to do glycogenolysis or gluconeogenesis. What is the missing enzyme? We can easily say that he is unable to break down glucagon or unable to produce new glucose. The deficient enzyme is glucose 6 phosphatase. The answer was glucose 6 phosphatase, and the disease was von Gerig disease. Next question was flow cytometry is done in. The answer was lymphocytosis, as it is used for identification and the classification of T and B cells. Following does not indicate megaloblastic anemia. So this is not seen in megaloblastic anemia. The answer is increased reticulocyte count. Increased retic count, as in MA they say that there is decreased retic count. Myelofibrosis leading to dry tap on bone marrow aspiration. There is myelofibrosis that results to dry tap in bone marrow aspiration. The condition is acute megakaryocytic leukemia. So this was also asked. This is an important question and a probable APPG question. Acute megakaryocytic leukemia. Frequently asked question also in APPG regarding apoptosis and anti-apoptotic factors. They have asked this year CD95 is a marker of. Answer is extrinsic path of apoptosis. And another frequently asked and probable APPG question is regarding kidney pathology. They have given a scenario that kidney specimen showing fibrinoid necrosis. The answer was hyperplastic arteriosclerosis. Some onion peel like appearance also in some hyperplastic arteriosclerosis. Person having sickle cell trait is protected from. Next question. Person with sickle cell trait is protected from. The answer is Plasmodium falciparum. They have asked about a mutation in COL4A5 causes what syndrome? The answer was Alport's. Then they have asked about markers, very important in APPG also. Marker of myeloid cancer. The answer is common leukocyte antigen CD45. Also remember S100 and HMB45 for melanoma. Then they have given a clinical scenario that adult with generalized lymphadenopathy, smear showing 80% lymphocytes. Those are the two immature lymphocytes, and chest X-ray with large mediastinal mass. Now they have asked a diagnostic feature. The answer was patient's blast cells demonstrate immature T cell phenotype. The answer was patient's blast cells demonstrate immature T cell phenotype. Next question was asked regarding Down syndrome. I have given that one parent with balanced translocation between chromosome 15 and 21. They have asked what is advised to couple to prevent Down syndrome. The answer was adoption, as Robertsonian balanced translocation has 100%, nearly 100% chance of giving a Down's birth. Better is an adoption. Hyperacute rejection is due to, this was asked. What causes hyperacute rejection? Very important. The answer is preformed antibodies. It is preformed antibodies. Remember, it is not due to cytotoxic T cell mediated injury, or not due to endotheliitis. Next question, mutation in which of the following genes is important in paroxysmal nocturnal hemoglobinuria? In paroxysmal which mutation? The answer is GPI, glycosyl phosphatidyl inositol. Very important question, this one, regarding staining procedures, probable APPG question. Staining done for sebaceous cell carcinoma, answer is oil red O. Receptor on neuronal membrane that induces development of glioma. For development of glioma, which receptor is important? The answer was CD133. Again, they have asked a question regarding leukemias. Following doesn't require ALP, lumbar puncture, for diagnosis. The answer was Hodgkin's lymphoma. As clinical and radiological diagnosis with histopathology is sufficient, but NHL will require a biopsy. That is important to remember. NHL also requires an LP, and Hodgkin's does not require an LP. Next question was from SPM, aerosol spread of which causes epidemics? Among the given options, the correct answer was influenza. Next was a fixative used in electron microscopy. Remember friends, is very important. It is glutaraldehyde. Source belongs to, very important. It is coronavirus. All are true. except regarding bacteroids fragilis. One question was asked regarding bacteroids fragilis. The answer was shock and DIC common is the answer was this, but regarding bacteroids fragilis, shock and DIC are uncommon, as LPS is not potent from bacteroids fragilis. Next question, farmer from sub-Himalayan region with multiple leg ulcers. The causative is Sporothrix schenki. This is very important question. Again a clinical scenario. Farmer with high fever, painful inguinal lymphadenopathy with vomiting, diarrhea. Which of the following stain helpful in diagnosis? Which stain helps in diagnosis? The clinical picture is Yersinia pestis. The stain useful is Wasson's stain and also Wright Jamesa. The answer was Wasson. They have asked another question, endotoxin of which no part in pathogenesis. Endotoxin of which gram-negative bacteria has, you know that usually endotoxins has a good role in pathogenesis, no role in pathogenesis. The answer was Vibrio cholera. From Pharma, this was asked, Rho kinase inhibitor is a very important drug to remember, Fosdil. It is Fosdil, and late Na plus current which decreases, that is renolazine. These are all used in CVS drugs used to decrease IHD. Next question was not second generation antihistamine. The answer is cyclizine. Remember, cetirizine, loratadine, avastin, ripatadine, fexofenadine, all these are second generation antihistamines. Mode of action of gentamicin when it is given intratympanic. What is the mode of action? The answer is direct hair cell toxicity. This was the correct option, direct hair cell toxicity. Most common ophthalmic complication in patient with HIV on heart. After lot of searching, the correct answer was retinitis. This is very important. A person with fractured teeth and injury around mouth. A person with fractured teeth and injury around mouth. What is the injury? It is grievous. The answer was grievous injury. Double base smokeless gunpowder. What is double base smokeless gunpowder? What does it contain? The answer is it contains both the nitrocellulose and nitroglycerin. Semen analysis is also important. Blue white color in UV rays seen in, this is during semen analysis. The answer was semen. Next question was choking seen in, answer was shotgun. Friends, I could complete some of the important questions from AIIMS 2012 and probable APPG questions from the preclinical subjects once go through.